Alzheimer's disease links to oral bacteria. The most common form of dementia, Alzheimer's disease (AD), is a neurodegenerative disorder primarily affecting cognitive ability and psychiatric health. Alzheimer's is defined by the Alzheimer's Foundation of America as a progressive, degenerative disorder that attacks the brain's nerve cells, or neurons, resulting in loss of memory, loss of thinking and language skills, and behavioral changes. There are two main types of Alzheimer's: familial onset, early onset, and late onset, also referred to as LOAD. LOAD accounts for 98% of all cases and occurs in adults ages 65 and older, with the prevalence increasing by nearly 50% at age 85. According to the latest Alzheimer's facts and figures, 5.5 million American adults are afflicted with the disease, and the number is projected to increase to 16 million by 2050. AD is a complex, chronic brain disorder diagnosed by obtaining a thorough, detailed medical history, conducting lab tests and brain scans, and performing a physical exam and neuropsychological tests to determine cognitive skills. Symptoms of AD can be attributed to other forms of dementia and dozens of other ailments, so a proper diagnosis is crucial. Although a diagnosis of up to 90% accuracy can be made, absolute confirmation of the disease is only possible by examining the brain through an autopsy. AD has many symptoms and characteristics, some presenting earlier than others. The Alzheimer's Foundation of America reports that early symptoms include memory loss that disrupts daily life, difficulty problem solving, confusion with time and place, inability to communicate or understand what's being said, difficulty performing everyday tasks such as bathing, brushing teeth, and getting dressed, and difficulty perceiving visceral information such as the need to urinate or pain from a toothache. The Foundation also states that depression, changes in personality, agitation, and hallucinations are the most significant psychiatric characteristics. Alzheimer's is the sixth leading cause of death in the United States and the only top 10 disease that cannot be prevented, cured, or even slowed, perhaps until now. The definitive pathogenesis of Alzheimer's is unknown. A recent study by Olson and Singrao discovered that in addition to the trademark indicators of beta-amyloid plaques and neurofibrillary tangles, other indicators of the disease's neuropathology are inflammatory pathogens. The authors state that the inflammatory pathology may be linked to the presence of a peripheral inflammatory infection such as periodontal disease, due to the presence of periodontal-associated bacteria found in AD brains. Periodontal disease. Periodontal disease is considered a low-grade, chronic, inflammatory disease. It is characterized by the presence of pathogenic bacteria that cause gingival inflammation, bone loss, attachment loss, tooth mobility, and if left untreated, tooth loss. Most people are not aware that they have periodontal disease because they do not visit a dentist on a regular basis, and the disease usually does not cause discomfort. However, according to the article, CDC, half of Americans have periodontal disease, 47.2% of American adults have some degree of periodontal disease, with the prevalence increasing to 70.1% in adults 65 and older. Mode of transportation of microbes to the brain. One of the most common ways microbes reach the brain is through the bloodstream. During chewing, flossing, and dental treatment, periodontal bacteria are released into the bloodstream and can remain there for up to 3 hours. In a healthy person, bacteremia is contained by the immune system. However, in older adults with a compromised immune system, bacteria can remain in periodontal pockets and continue to be released. Another way microbes reach the brain is by crossing the blood-brain barrier. With age, the presence of an overabundance of bacteria and microorganisms compromises the integrity of the blood-brain barrier, making it easy for microbes to invade and destroy nerve tissue. The increased permeability of the blood-brain barrier with age results in promoting AD. The links: oral bacteria. In the oral cavity, a plethora of bacteria are found in the sticky plaque biofilm that covers the many surfaces in the mouth. Additionally, deep periodontal pockets can form and collect plaque, tartar and other debris and harbor a high number of pathogenic bacteria. Oral bacteria associated with periodontal disease and implicated in AD include P. gingivalis, T. forsythia, F. nucleatum, and P. intermedia. 6 oral Treponema spirochetes, T. denticola, T. pectinivorum, T. vincenti, T. amylovorum, T. multifilum, and T. sokrinski, have also been found in AD brains. The notable characteristics about spirochetes in relation to their link to AD include being neurotropic in nature, meaning they specifically target and destroy nerve tissue, induce and contribute to inflammation, and form amyloid plaques and neurofibrillary tangles, the hallmark indicators of AD. In a study of 2,355 subjects over the age of 60, higher levels of antibodies to periodontal pathogens were found in the subjects who were cognitively intact at baseline but then developed AD, than those who did not develop AD. Another study conducted in 60 subjects with mild to moderate AD showed a six-fold increase in rate of cognitive decline after 6 months. Furthermore, this study showed an increase in periodontal-associated pro-inflammatory cytokines after 6 months. In addition to demonstrating a strong correlation between periodontal disease and AD, it is indicative that periodontal disease was present prior to the onset of AD.